Good evening, Naples community. Welcome and once again to our weekly community forum. I'd like to introduce our panelists this evening. Please join me in welcoming Robert Duffy, President and Chief Executive Officer of the Greater Rochester Chamber of Commerce, former Rochester City Police Chief, City of Rochester Mayor, and New York State Lieutenant Governor. Mr. Duffy will discuss the information gathering and monitoring process, which informs the decisions about how we proceed with the reopening of our local economy in a safe, effective, and responsible manner. Please also welcome once again Naples' own Jennifer Emmons, RN and an Executive Director of Hospice House here in Naples. Jennifer will update us from the front lines in Saddle River, New Jersey, where she's answered the call to assist in an area of most critical need. We're currently in day 78 of the COVID-19 pandemic, and it's hard, right? Our residents and businesses are suffering pretty serious financial hardships. Recognizably, our communities are suffering from emotional distress as a result of financial concerns, business survival concerns, and the challenges we face on an everyday basis due to the changes brought about by this pandemic. Yes, it's hard, but we're fortunate as a community due to the very nature of how we tend to band together in times of crisis. This attribute isn't new. We've always done this. The only thing that's different is that now we have an entire community in some form of distress or another at the same time, but still an entire community that bands together to ensure that we're doing everything we can to provide for one another. What Naples truly has is courage. As Winston Churchill once said, courage is what it takes to stand up and speak. Courage is also what it takes to sit down and listen. I'd like to take a moment to recognize the many local efforts that help to keep the community fed and address any number of emergent situations. The Naples Open Cupboard, an effort of the Naples Council of Churches and located on Harwood Lane directly behind the town and village offices. This food pantry is open on Wednesdays and Saturdays from 11 a.m. to 2 p.m. Thank you to our community for the generous donations pouring in and the coordinated efforts with Reynoldson's Market to ensure that no person in this community will go without food and basic necessities. Thank you to the Naples Rotary responders and your number of selfless volunteers who ensure that groceries can be addressed, delivery of essentials and other needs of our community are met on an individual basis. Thank you to Pepper Makepeace and the team of individuals who tirelessly work to update and provide critical information to our business community through the newly launched website, www.naplesmeansbusiness.com. Let's not forget the Naples Angels. This organization has been in existence for quite some time, and its mission is to provide emergency assistance to members of our community. While their efforts are humble and quiet, I've personally seen many occasions where their assistance to the members of our community have made all the difference in the world to individuals and families. If you or a family member is having difficulty meeting a genuine need and have exhausted other options, please reach out to Jack and Sharon Fredericks at 585-374-5277. The Naples Angels resources could use a little help from the community at this time. If you're able to do so, please help the Angels help our community by considering a donation to their cause. Donations can be mailed to Naples Angels, P.O. Box 236, Naples, New York, 14512. Also, hats off to our first responders, our police, ambulance, and fire personnel who assist our every needs always during this pandemic and before. Your service to the community is so well recognized and appreciated. Speaking of fire departments, our very own Naples Fire Department, Maxfield Hose Company, is holding a chicken barbecue fundraiser this Saturday, May 23rd, from noon until sold out with drive-through service at 2 Race Street, right here in the village. Please consider supporting their efforts. There are a number of other individuals and organizations not mentioned, but please know that your efforts on behalf of our community are well recognized and speak to the strong fabric, character, and courage that is the Naples community. On to local and state developments. Municipal buildings remain closed to public traffic until further notice. Contact information for all departments is listed on all municipal building doors. If you need assistance from the town office, please reach out to Joanne, Joanne, at naplesny.us or call 585-374-2111. If you need assistance from the village office, please reach out to Megan at megan@naplesny.us or call 585-374-2435. Please either leave a message, email, or voice message, and your inquiry will be responded to as quickly as possible. Essential services continue to be performed and brush pickup within the village resumed this week. As of this afternoon, Ontario County is reporting 151 confirmed cases of COVID-19, 5 hospitalized, 145 in quarantine or isolation, and 12 lives lost. As of this morning, the New York State Department of Health is reporting 348,232 confirmed cases and 22,478 deaths, including 139 lost overnight. The New York State on Pause executive order was modified on Thursday with a particular focus on the effort of reopening business. This effort, which we have come to refer to as New York State Unpause, is a phased approach in which specific regions across the state have been established to gather information which is used to inform the decisions about how we restart our local economy in the most safe, effective, and responsible manner. I'd like to thank the number of local business owners that took the time to prepare very thoughtful feedback in consideration of reopening their individual businesses. Most of all, these responses are reflected in the templates recently published by the New York State Health Department. As we move through this reopening process, I'd kindly ask everyone to be patient and understanding of the fact that these efforts truly represent the safeguarding of human lives. This conversation is not about I, me, or my. It's most assuredly about us, each and every one of us. It's an honor to welcome the person appointed by the governor to lead the charge in the Rochester and Finger Lakes region as we embark on brighter times, Mr. Robert Duffy. Thank you for being with us this evening, Bob. Our business owners are both excited and cautious about their plans for reopening. Can you offer some insight on the process for doing so? What elements are ultimately in place to inform the decisions as we move forward?
Yes, I can. First of all, Brian, I want to thank you for your great leadership. And this introduction is heartwarming. There, you go through point by point about Naples, and I'm very familiar with Naples since I was a child. It's a wonderful community. I want to thank Jennifer for being on the front lines and putting her life and health at risk every day. She represents the men and women who really are making the progress happen here. Very quickly, I'm happy to take questions. The new assignment I have from the governor is to really help the Finger Lakes region, to advise him on Finger Lakes region to be part of this control room. The plans that are being put in place, and you can go on to newyorkforward.gov website and you can go through point by point the template. But I'll really boil it down to 4 components. If every plan has a component for face covering, face masks per CDC guidelines, social distancing, good hand hygiene, and by good hand hygiene, it doesn't have to be hand sanitizer. Hand sanitizer is expensive. Soap and warm water works just as well. And the last part is disinfecting. Doorknobs, surfaces, computers, phones, things that are touched every day that where the virus could live. And there are other things that will come into play depending on the business. Some construction sites may require temperature taking. Those variations are going to go really be differentiated by different industries, but it is all about having a plan in place, preparing that to protect employees and protect customers. And just very quickly, on those plans, a couple of things. The state does not have to approve the plan before you open. That would be a process that would probably take weeks. You will go on a website and self-certify. You'll go answer questions in a template, certify you have a plan in place. There won't be an inspection process per se, but I do want to let people know, here's what could happen. If an employee gets sick, if a customer gets sick, if there is a complaint, somebody walks in and says that this company or business is not abiding by those rules, the enforcement is usually done at the local level. It could be a town, village, county official stop in to ensure. They may want to look at your plan. So have that in place. And the last point I'll make, and I mentioned this to Brian earlier, it's something that I cannot reinforce enough. We don't know what the liability field will be at the end of this. And so if a business does not take some basic responsible actions, again, to protect employees and customers, there could be a whole wide open issue with liability down the road. I'm not sure the legislature will put together a shield protecting everybody. I don't think that's going to happen. If it did happen, it probably would be challenged in court. But we can expect there will be litigation for this. And I just would caution everybody and also encourage them, have a plan in place, some good faith efforts to take those protections. I think you'll help yourself.
Thank you, Bob. There are a couple of questions, and Renee asks, and apparently this is regarding two separate businesses. First, she asked who's overseeing the regulations for opening business sanitation practice. I think you actually addressed that. And will there be inspections occurring? I think you actually addressed that as well. Did you not?
Just very quickly, the process and what I've done since I've taken on this role, I have forwarded literally hundreds of plans from associations, organizations, individual businesses, not to be inspected, but to put them in the hands of the governor's people. He has a great analytics team going on behind the scenes, a cadre of men and women. All they do all day is come up with best practices in each one of these areas for reopening plans. So that's the process. And when they come out with these new updated regulations, it's based on what they feel are best practices. And some are very specific and very complex. Inspections, I just mentioned before, state probably won't come in, although Department of Labor could if there was an employee complaint. But inspections will probably come if there is an issue with a customer, an employee. Let's say, folks, probably a large portion, if not half of the emails and phone calls I get every day are coming from employees of businesses, dental hygienists, physician's assistants, others who are afraid to go back to work and have children, have older parents, have families that they're afraid. So there's a trepidation of employees to come back to work once the business is reopened. So it really is about having just a strong plan in place. And I do think there's so much common sense out there. I'm talking to experts right now. You know what you need to do to get that in place. If anybody's listening, if you would like any advice or help on that, Brian, you have our email. You can connect an email question to me anytime. Myself, I have a great teammate, Mark Cohen, is side by side every day with me. We will get an answer for you. I never want to guess on something I don't know, so I'll get the facts and get back.
All right, thank you. And there's another one. This is a really good one, and I'm sure that several businesses kind of fall in these what we might call cracks, right? There's the question is wedding venues. Where do venues fall into the phases, and where are the regulations on that? I don't know if they're specifically called out. Is that correct, Bob?
Great question. Wedding venues, house of worship, faith communities, gatherings, that's all going to be coming down in later phases. I want to be because I'll get calls about freedom of religion. It is not about the activity itself. It's all about the gathering. It's people coming together in large numbers that can really perpetuate the virus and create a spread. They're dealing with that right now. I've been asked by a number of people about weddings in June, and I would say, I don't want to tell you to cancel your ceremony or wedding, but I would say have a backup plan. Because if you look at, we look at our community here, our region, from Naples to Rochester to Penn Yan to Victor, all of us, we're really pained by things that are closing. And then step back and think about March Madness, the NBA, Major League Baseball, hockey, football is pretty much wondering what's going to happen. All these major events, our Jazz Festival, Lila Festival, they've all been canceled or postponed. And so all these steps are taken right now. And when there is a green light to go ahead, it's going to be based on certain things that, like I mentioned before, the distancing, the face masks, the protection, how that is done. I did speak with the Diocese of Rochester, a Catholic diocese, and they're going to come up with a recommendation. Can they do drive-in services? There's a number of drive-ins in our region. And I do think that could be approved because it really promotes all the things we're talking about right now. I've sent that forward. I've not received anything back yet, but I do think people are looking for ways, can we get this going? And I think that the wedding venues, the wineries, I think next up you'll see after hair salons, what have you, you may see some changes and regulations on restaurants and venues. I would say those are like phase 3 and beyond. I think the governor even said phase 4 is higher education, large gatherings. And I can't put a date on that. Phase 1 started last Friday. The governor said at least 2 weeks between phases. I know the governor very well. I always look, the key words are at least, because we don't know, it could be more. If our numbers go up, that'll be delayed. So all the more reason for us to follow all these protocols. But if people are out there wondering, do I cancel a wedding, or if you're a venue right now, if it's in May or June, I think it's a very difficult time. July could be in question. I think August right now, you're getting a little closer to home. But I'm just guessing because I do not know for certain. I never want to guess what date certain these things would be, but I do think those gatherings will be at the other end of this process.
Yeah, this is kind of a difficult process. This whole region, Rochester, Finger Lakes, we're all wholly dependent on tourism. And we're talking about this businesses that are essential to supporting that and supporting themselves. It all makes sense. The protocols really, following those protocols as we move forward really determines how well we progress. Thanks for that. I do have another question for you, Bob. May or may not be able to address this because it's relatively detailed and it has to do with bed and breakfast type businesses. And this particular one, the concern was they have an open kitchen, pool and hot tubs, and they're wondering how they're going to deal with those types of situations. Obviously, the masks and gloves and other personal protection gear. But this one states their kitchen's smack dab right in the middle of the house and open. And when they're allowed to open, do we know if they're still allowed to use that communal guest kitchen? Are there any answers for that, or is this something we need?
That's a great question, Brian. In terms of the hot tub and the pool, I wouldn't weigh in on that one yet.
Right.
For the kitchen, I know there'd be that constant disinfecting. Accommodations are beginning to open up now. And I've had a lot of questions about the bed and breakfast, Airbnb, especially in the Finger Lakes region, which we know cottage rentals and things that will go on throughout the summer. That's one. If you could zip me an email, I'll try and get a more specific answer. I don't want to mislead people.
Right.
What I think what you'll expect is when they come out, there will be, if you open, these are the things you have to do. And I'll give you an example. Marinas are now open in Finger Lakes. So you can go out, you can get your boat out, docks are being put in. You can rent a charter fishing boat, but a regular boat rental, if maybe 3 of us want to go out on a boat at a marina for a day, we can't do that right now. So there's a number of stipulations on that. And I'll give you an example of the golf cart issue that just got opened up again. The reason golf carts were banned were not because of the golfers. It was because of fear of the men and women who work at the golf course who have to disinfect those, that they would be exposed over and over again to this. And all those courses have put into place these really stringent disinfectant strategies. So the same, when it's approved, whatever that would be, I think for anyone with an Airbnb or rentals, that it will come with stipulations. And I'm looking at things, and Jennifer knows far better than I what those areas would be, how you can catch an infection or be infected. But I would say just absolutely stringent distancing, cleansing, disinfecting over and over again. And that's going to be an expense and a lot of work on behalf of business owners going forward. If every time somebody comes into a business and touches something or sits down, it's a process going to have to take place until there was a vaccine.
Yeah, I appreciate that, Bob. And maybe now is a really good time because we touched on this several times, how important it is to maintain those sanitary protocols as we move through this process of reopening. Jennifer, maybe you want to touch on this and explain from your perspective why it's important. And look, you're right at ground zero, and you see things that we don't see here. And the reason we don't see them is because we don't have the density that New York City and the areas of Saddle River, New Jersey have. That much it goes without saying. But yeah, if you can speak to that, that'd be awesome.
Yeah, so when we're talking about that social distancing, the reason that we keep saying 6 feet apart is because of the way that we can transfer this virus from person to person through our coughs, our sneezes, and yes, talking to each other, because we do have, droplets that spray out when we speak. That's why we're asking you to stay 6 feet apart from each other. That's also why we're asking you to wear masks. So this last couple weeks, again, we seem to be back to where we're saying, but masks don't stop you from getting it. No, again, it's meant to keep that spit and those droplets to yourself. And if both people are wearing masks, so as these businesses start to open up, if I'm going to do a curbside pickup of something and I'm wearing a mask, and the person that's going to be delivering whatever it is I'm picking up is wearing a mask, we have just both reduced our risk of talking, spitting at each other, picking that up. We keep talking about the frequent hand washing, and soap and water is actually better than hand sanitizer. Remember that part. Make sure that it's lots of suds, because it's those suds that are breaking down that RNA protein virus, which is what the coronavirus is. We want you to continue to make sure that you are disinfecting the frequently touched surfaces, because one of the things that we're doing when we have this virus, viral shedding. So we're shedding this virus by everything that we touch. If I have this virus and I'm holding on to this glass, and then somebody comes along behind me and picks this up, yeah, they have the ability. This virus stays viable on surfaces, remember, up to several days. One thing that I really would like to talk about is, I've heard a lot of people still continue to say, but I feel fine, I'm not sick, and neither is the person that is touching these same surfaces. Asymptomatic. I keep trying to hammer that into people's heads, and either you're going to believe it or you're not. But we are walking around, we are not feeling sick, we are not looking sick, we are not always running fevers, we're not always coughing, we still have the virus. So if I'm not wearing my mask, if I'm touching these things, or somebody comes along behind me and chooses to touch the same things, and then they touch their face. So Brian always ends these forums with, wash your hands, don't touch your face. The good news is this virus right now, the only way that it has the ability to hurt us is still the same things that we've been hearing. We don't want to put it into our system, and where we put that in is our eyes, our nose, and our mouth. So you've heard me say that for 6, 8 weeks, however long we've been doing these forums now. So if you're a business that now gets to reopen, congratulations. I have to say, I'm glad that we're going to start to reopen, but we have to do it safely. Think about things such as coffee pots. Everybody grabs that coffee pot handle, your doorknobs, anything that you touch. Start now. If you haven't already started, just paying attention to what you're doing every single day, all day, how many things you touch. It took me a while. One of my hardest parts when I came down here was my pen, because obviously working as a nurse, I'm forever writing something down, and I would put that pen in my pocket, and then I would wash my hands and wash everything that I had touched, and I'd forget about that pen. So, you may not have to think about it quite at that level, but like I said, start paying attention, knowing that the surfaces that we're touching, we can be picking it up. And then if we accidentally touch our eyes, our nose, or our mouth, we can put that virus into our system. So when we talk about that disinfecting, remember, it's a bleach solution. If you can't get your hands on, a cleaner that specifically says coronavirus or SARS, use bleach and water.
So Jen, there is a question for you. Stephen asks, have we learned anything about reinfection or immunity?
I can tell you what I'm seeing down here. I can tell you what we're hearing from our medical professionals. Again, I always have to be very clear that we're studying this while it's happening. So when we talk about evidence-based, those are very large numbers and longer studies. But one of the things that we're doing a lot more of here than back at home is we're doing a lot more testing right now. We were hearing, well, if you get the antibody test, typically what we know about viral infections is If you have the antibodies, that means that you've been exposed to it in some way or another. Something like measles, you have the antibodies and you're not going to get that again. I can tell you that what I am seeing with my patients here in this facility is they get this virus. They clear this virus because they test positive through those nasal swabs that we're using. If they get better, I can clear them. I can test them again. They are negative, even if they're remaining isolated and they're showing the antibodies. We are seeing where there have been people that have gotten this again. But we don't have a definitive answer as to why, who those people are, what all of those different variables are when we're trying to collect this data. But what we know right now is that we cannot safely tell you that if you had this, if you cleared it from your system and you survived this virus, that you wouldn't get it again. Nobody can tell you that that is the answer. So if you happen to be somebody that gets this virus, or if you go get the antibody testing and you find out that you have the antibodies, please don't think that you are 100% safe, because you're not. Nobody is. Not right now.
So Jennifer, there's a couple of questions, 3 or 4 actually, about certain practices with our gear, if you will, our face masks or gloves, so on and so forth. There is some concern about folks not properly wearing a mask, and we've discussed these on a number of occasions. There are a number of folks. I want to make this point clear. There are folks with issues, whether they be health issues or other issues that prevent them from wearing a mask. So we need to be cognizant of that, and you know, try to understand that not everybody can. Most can, but not everybody can. But do you want to touch on some of those proper procedures for wearing masks or gloves or anything of that nature?
Mm-hmm. So your number one thing to remember is clean hands when you're putting your mask on or when you're taking it off. That really would be what you want to focus on the most. We see a lot of people that wear their mask just over their mouth and they let their nose hang out. Nope, that's not exactly how we're supposed to do it. But, you know, we see so much nitpicking and negativity. Let's be realistic. We're not all going to do things perfectly. I'm going to tell you today, I walked onto a COVID unit and I didn't have a mask on because I was tired and I forgot and I had taken it off just prior to. We're not perfect. We're people. So if you see somebody wearing a mask with their nose hanging out, you don't know what that person's situation is. So try not to, you know, focus on all of those. They're not doing it right. You know what? They tried. Half of their face is covered up. But you want your clean hands, because if you've touched everything out in your environment or in your public, and then you go to take this mask off, especially if you're going to go to 1 or 2 or 3 places. If I'm wearing my mask and I don't have clean hands and I take it off and I set it someplace in my car and I drive on to the next place, my hands aren't clean, I pick it up, I might be touching the inside of that mask and then putting this, if the virus was on my hands, right exactly where it needs to be to hurt me. So
Right.
clean hands is the number one. Usually it's the clean hands and people's noses hanging out. I can't monitor the questions right now, so
Yeah,
I'm not sure
I'm
if that's what
watching.
they asked.
Yeah, you addressed the question. I think primarily here's what it is. We need to recognize the people's efforts, recognize that not everybody can physically follow all of the protocols, and to try to be kind at the same time and recognize those issues. And I think what you touched on is the most important thing. Us as individuals, no matter what we do, where we go, what we touch, we need to remember personally, it's our personal responsibility to sanitize our hands or wash our own hands. That's what prevents us from becoming infected. The masks out in public simply protect others in the event that you are COVID-19 positive, whether you're symptomatic or not. And And I think, I know we repeat this over and over again, but I think it needs to be done because questions do keep coming up. I didn't get any other health questions at the moment for you. Was there something else that you wanted to add, Jennifer?
I don't think so. Yes, actually, you had touched on gloves. Somebody asked about gloves.
It did, and it was a reference to the general public wearing gloves while out. And again, it boils down to being able to take personal responsibility for sanitizing your own hands because you are going to come in contact with or without gloves. People that wear gloves, I get it, they understand how to, and because they've been in an environment where they're used to that. But
Right.
generally speaking, go ahead, I'm sorry.
General public, you know, I don't want to tell you that you don't need to wear gloves, but you need to ask yourself, why are you wearing them? This virus can't hurt us on our hands, remember. It hurts us when we take it from our hands and put it into our system. So if you're going to wear gloves to help you remember not to touch your face, by all means, great, wear those gloves. But if you're going to wear gloves and then still touch your phone and your keys and your steering wheel, and then you take your gloves off and you still touch your phone and your keys and your steering wheel and then touch your face, you just wasted your money and time wearing gloves. So ask yourself, why are you wearing gloves? How is it protecting you? And how could it be harmful to you as well?
Right. And I think people that are used to doing that, whether they're used to being in a healthcare environment or a scientific environment, they understand the proper use. But in general, I have to agree that, you know, is it necessary? But if you'd like to, it's understood.
Part of that is that mental health piece too. Does it make you feel better? You know, I work with a lot of aides that are begging for gowns, and unfortunately we don't have enough to give to everybody. You know, and I may know that they're working in an environment that they don't need to have a gown, whether it's a gown or their regular scrub uniform, it's all the same. But if it makes them feel better, if it makes them be more positive and be more kind to other people. So again, watch that nitpicking out in the public. If you're a healthcare worker, you know, like I do, we could teach you all day long how to wear gloves and wear a mask absolutely perfectly. This is our world. This isn't a hospital setting. So we have to be realistic. We have to find that happy medium.
Right. Okay.
If I can add one thing too.
Yes.
Jennifer said something before I thought was really profound about remembering where people are. And I just would add, people have lost their jobs, their livelihoods, they've lost relatives. The stress and anxiety out there and the mental health implication of this cannot be stressed enough. You see it everywhere. And I think people are just feeling more stressed than ever. There's so much fear about the virus going back to work. There's people who are, who are upset if they're told to wear a mask. Those are upset if somebody's not wearing a mask. But I do think we have to understand everybody's dealing with this very differently, and there's just so much stress and anxiety going on. And I've said this for years throughout my careers. You never know what the other person is going through in his or her life, and it could be a traffic accident, it could be an interaction at a store. And something small can blow up to something very, very big because some people are just dealing with so much. And I think now with the uncertainties, the economic uncertainties, and we even worry about after these reopenings, a lot of economists are saying that it'll get worse come July and August for the next 18 months to 2 years. And what I worry about too is when the PPE money is out and people are holding their numbers right now with employees, layoffs may start August, September, which is going to add to this pain and anxiety. So I think there's one area we just cannot reinforce enough, just to be respectful, kind, understand other people, because everybody's dealing with an awful lot right now.
Mr. Duffy, you had just mentioned something that I actually had my own question. For the businesses that are required to have their employees wear masks, where are they getting those? Are they responsible to have the homemade masks themselves? Are there resources for the businesses to be able to purchase these masks from?
Great question. A business is responsible for getting their own. I know Monroe County just gave out 1 million masks. They were passing them out to families and homes. Most businesses right now that I know have contracted with somebody, and I do think the price points are coming down. When it first started, I thought prices were exorbitant and a lot of price gouging going on. Now it's somewhat back to normal. But I think we look at that there's different levels. You know better than I. The N95 mask is not expected in every work environment, but I think there's like a class 2, or I think the FDA or CDC approved certain levels. I think they should consult with a healthcare professional in terms of a level they should get. But there are a lot of people out there now. I get emails every day about providers looking to sell. I know Hickey Freeman started making those in Rochester. A number of our clothing companies turned over, started making those. They're coming in from many different directions, but if you own a business, it's your responsibility to make sure your employees have, and it's per CDC guidelines. If you cannot socially distance, you're required to have a mask. But that's the business requirement to make sure that they have enough for their employees. Not to say this, Wegmans, I think, I listened to a call one day. They go through thousands and thousands of masks per week per store. So it gives you a sense there is an expense here for compiling it. As you know, especially in the healthcare world, there's a huge expense, but for businesses, there is going to be expense with that, but it's going to be a necessary one until there's a vaccine.
And hopefully those expenses can be deducted somewhere along the way, thinking forward. And yes, that exact question was privately messaged to me as you were asking it, Jennifer, so thank you. Bob, I do have another question for you. And I think it might be a little off in the weeds as far as the realm of reopening for business, but perhaps you've heard if there's any discussion surrounding this. Steve asks, will the state be providing any grace periods for property taxes for taxpayers that become due during a pandemic?
Good question. Most property taxes are to the localities, the counties. Cities and counties collect those. And I do think a number of those jurisdictions have given some grace periods already. The state has relaxed some of their guidelines. I don't want to infer that some are done and others aren't. I know that everybody, here's the thing, they're relaxing those. Town, as you know, town, village, city, county governments are all hurting right now with the sales tax revenue. I think they've all tried to do that. How long it continues, I don't know. But I know there's like the state with the DMV, if you have registrations, don't worry about it. Inspections, they're going to give grace periods for that being overdue. They know you can't get those done right now. But property taxes, by and large, will be a county decision. And it's going to be an individual county that will make those assessments.
Yeah, and I wanted to see if you had gotten any feedback or if that question's been discussed in your circles. I did actually do some research on the village level, and I came to find that because our village taxes actually become, the bills are generated and sent out the 1st of June, due about 30 days later. I did discover that in this situation, it's the governor that has the authority to grant a village or a city specifically the ability to extend that grace period by up to 21 days, I believe it is. And to answer that, the person that asked the question, the Village of Naples actually did make that request directly to the governor's legal counsel last week. And I hope to receive an answer.
Was there a response yet for that?
There hasn't been a response. There hasn't been a response yet, Bob. Can I send you a copy of that?
Yeah, send me an email. I'll follow through because never want to guess what somebody may or may not do in that case. But like our taxes, our federal government extended our tax deadline, from May 15th into the summer, which was great for people that couldn't pay at that time. I do think everybody's trying to help each other, but I would not want to give a guess without getting an answer. But if you send me that, I will get an email going tonight or tomorrow morning up to the governor's team as well and ask for clarification on that.
Yeah, because I sent the request and again, there's a lot going on. So it's anyone's guess as to how long it takes for somebody to review that. But thank you for that. Much appreciated. Um, I have another question. Can an employer force you back to work if you have a high risk condition with a threat of dismissal if you don't return? Anybody know the answer to that?
That's a great question for HR. Here's the thing: if I know from the PPE, the guidelines, when people are like on unemployment and come back, an employer can offer you your job back, and they can offer you if you decline to come back off unemployment. They are not required to maintain you. I've heard that from several HR professionals. That case, I just took a question just yesterday from an organization in Rochester, and I sent that to Dr. Mendoza at the county health on that department because if somebody has a condition and they're fearful, this is where I think a lot of human resource and job issues and even liability issues will come up, and I don't think they've been resolved with clarity yet. And if somebody has a precondition that they're concerned about going back, they don't want to go back, they're being forced to. I hate to think an employer would just fire that person, but I'd like to get some clarity on that. I have a great HR leader at the chamber. I'll ask her tomorrow. I'm married to an HR director. I could probably ask her in 5 minutes what she thinks, but I would get clarity from the state on that as well in terms of what the Department of Labor, what the guidelines have been. It's a very good question, and that has popped up a lot recently.
Yeah, that speaks to the concerns that people have, the plethora of concerns that people have, and every effort that any one of us can make to address those, I'm sure can be helpful in some way. I'm not seeing any further questions at the moment. Was there anything else that either one of you wanted to address while we're in this live feed?
Thank you both. I really thank, again, Brian, for what you've done here in terms of your leadership. This is great. I'm not aware of any local government doing something like this. And I think it's just a great way to communicate during some uncertain times with people in the village and the surrounding area. And I really applaud you for that. And Jennifer, who represents a cadre of heroes. I serve a big part of my career on front lines of public safety and have always had enormous respect for police officers, firefighters, EMTs, nurses, doctors, paramedics, people on the front lines in normal times. But these are not normal times. These are times when people like Jennifer can go into work and all of a sudden catch something that ends her life or maybe somebody in her family or a colleague. And the way people have endured this whole process, that people that have, fearlessly gone out and served and supported and treated people, it's phenomenal. So I think I can speak for thousands of people with the gratitude that we have for what you're doing. And I would say, Brian, on a government level too, government matters. It does. And, as an official, we get blamed for everything all the time anyway. But this is where government matters because you really do impact people's lives in a positive way. And, the governor is a friend and a colleague. I've served with the governor. I knew him before he was the governor. He's doing a great job with this pandemic. And people are not going to agree with every decision. And I think we would agree, and on your best day, half would agree, half would not agree with whatever you do in public life. But I think for these times, he has done a phenomenal job. He struggles with these decisions like we all do. The number one job for government is to protect its people. So you can't make decisions that are going to impact people's lives negatively. And so I think a lot goes into this, but what I'm seeing behind the scenes, I'm pretty proud of in terms of the thought going through. And people may not agree with those steps and delays, but look around the country for those states that opened up too soon, and they're starting to see those spikes. California opened their beaches. They try to close them the next day. That is what we don't want here. We don't want, once we start reopening, we don't want to have to close. If we do it safely, methodically, we keep on going because the economy does need to come back and need to get beyond the economic pain, but not at the cost of losing lives by doing something that's stupid or not right. So I just think having leadership like yours, what Jennifer's doing, the governor, other people in office, I'm not in elected office. I'm in a volunteer position for this. I have enormous respect for what you do and the responsibilities on your shoulders. And I think we're rounding third base right now. And I can't speak when a vaccine will come into play. I don't think it's going to be soon. I wish it would be, but just doing what we're doing right now is going to keep us going in the right direction.
Thanks, Bob. Much appreciated. Was there anything else you wanted to add, Jennifer?
Yeah, a couple of things. I did see that Paul had mentioned, he brought up the fact about transactions, money, cards, things like that. And I didn't mention that if you're a business that is reopened, try to have that hand hygiene, whether it's sanitizer or soap and water, in between each one of your customers. If at all possible, and we really should be thinking outside the box when we go to reopen, to try to have these transactions over the phone ahead of time, whether it's email, there's all sorts of apps that we use now to pay for things. So if you can avoid that actual contact with those transactions, I know that here in New Jersey, the 6 a.m. tomorrow morning, there's some non-essential construction that's opening, curbside pickup of retail businesses, and they're allowing gatherings in cars with some pretty specific rules. But one of those things is that there isn't those transactions of cash or cards, because it has to be a no contact curbside pickup. So that was a good point to bring up, because we are touching those, and a lot of people are touching those cards and that money. We know that money's dirty. The only other thing that I wanted to add was a huge thank you to not only people in Naples, but even in Monroe County and states away, but especially Naples, for all of the well wishes, the support, all of these things that you're sending to me here in New Jersey. I have been able to outfit more than 300 healthcare workers with different forms of PPE of some sort. I can't say thank you enough. It's amazing. They're working on creating signs to thank all of you. These folks here in New Jersey have no idea. They know now a little bit about what Naples is like. When we can have lots of tourists come in, we might have a lot of visitors. They've never seen support or community like what Naples is doing. I get boxes that have no note attached sometimes. I don't know where they came from. It's amazing. Nurses Week, we celebrated Nurses Week, and everybody got a pair of glasses from Coyote Eyewear that I think I'm up to like 300 or something of the eyewear. The lotions and the salves and the chapsticks and things that maybe you sent 10, 20, 30 of them and you don't realize that that's a big deal. It's a huge deal, because if I give one, local product to one person, that brightens their day, and then they care for 20, 30, 40, 60, 100 other people. And if this were your mom or dad, or your aunt or uncle, or your brother or sister in these facilities, you would want us to be caring for them without having this exhausted, tired, bad attitude. And again, that mental health piece. So just a card coming from our community. Everybody always wants to know, did you check your mail yet? What did you get today? Not because they're looking for something, because most of these folks don't have that. So I always say, my little tiny town without a red light, because then they understand why I'm so worried about driving in the traffic down here. And they've kind of adopted that phrase, your little tiny town without a red light. What did they have to say today? So, I'm usually pretty busy on my shifts, but I do have a lot more photos that I'll be able to share with the Naples community. And yes, you can feel free to share them, any photos with our patients or residents. There's been permission granted to share that. And then in turn, not only the healthcare workers and those residents, those patients, but their families as well. So just a huge thank you, and especially from me, because this isn't as easy as what people may think it is, and the support means the world to me. And thank you, Mr. Duffy, for joining us too.
Yeah, this community loves you, Jennifer. I think you know that, and we sure know how to pay it forward, right? All of your coworkers are seeing that. So, anything else from either one of you?
No, it's an honor and a privilege to be here. Thank you both for what you're doing.
Thank you too.
And stay healthy.
Thank you for being here. I'm going to sign off as I usually do. However, I'm going to alter it this week because things have changed, right? They've changed for the better. You're going to recognize the beginning. You won't recognize the end. Please wash your hands. Don't touch your face. Use caution in public space. Please be well and take care of your neighbors. God bless.
Thank you.